Hello everyone, welcome back to our channel with another video in the lower limb. I am happy to meet you all. So today's video is the popliteal fossa. Popliteal fossa is a shallow depression felt best at the back of the knee joint only when the knee joint is semi-flexed. It corresponds to the cubital fossa of the forearm. Now we will start with the topic popliteal fossa. It may be asked as essay, short notes, and it will be kept definitely in the practical exams in the first MBBS practical exams. So we will start with the boundaries of popliteal fossa. So what will be the boundaries? Above will be the back of thigh muscles. Below will be the back of leg muscles. So you are seeing this is the semimembranosus, semitendinosus, long head of biceps, short head of biceps. So these are the back of the thigh muscles. Back of the leg muscles, gastrocnemius and plantaris. So above and medially, semimembranosus and semitendinosus. Above and laterally, long head and short head of biceps femoris. Below and medially, medial head of gastrocnemius. Below and laterally, lateral head of gastrocnemius and plantaris. So these are the hamstring muscles in the back of the thigh and the back of leg muscles. So this is the popliteal fossa. So we will now see the floor of popliteal fossa. Floor of popliteal fossa, we will see the picture. So in the upper part it is bony. So it has three different floors. Upper part is bony, formed by the popliteal surface of the femur, and middle part is ligamentous, that is the ligament of knee joint, oblique popliteal ligament, and lower part is the muscle, popliteus muscle. So that is the three parts of the floor of the popliteal fossa. Roof of popliteal fossa, it's a strong deep fascia over the roof that is called as popliteal fascia. The students should remember the difference between the popliteal fascia and the fascia covering the popliteus. Popliteal fascia is the deep fascia in the roof of popliteal fossa, and fascia covering the popliteus is in the floor of the popliteal fossa. The roof is pierced by the small saphenous vein and posterior femoral cutaneous nerve. Contents, so it will have femoral artery. You have learnt femoral artery, which will be the continuing in the popliteal artery, popliteal fossa as the popliteal artery. So popliteal artery, popliteal vein, two divisions of the sciatic nerve, that is the tibial nerve and the common peroneal nerve, termination of small saphenous vein into the popliteal vein, posterior femoral cutaneous nerve, and genicular branch of posterior division of obturator nerve, popliteal lymph nodes, and a pad of fat. So what is the applied anatomy of popliteal fossa? We will see the contents after completing the applied anatomy. Popliteal abscess and tumors. This popliteal fascia, deep popliteal fascia is strong. So it limits the expansion. If we have an abscess or tumor in the popliteal fossa, the pain will be very severe. Wherever the deep fascia is not yielding, pain from the tumors or swellings will be severe. Now we will see the popliteal artery. So popliteal artery may be asked as separately as essay or short notes. So that I have covered separately. So what is popliteal artery? It is the continuation of femoral artery. Femoral artery we have learnt in detail. We have the video of femoral artery in our channel in the lower limb playlist. So you go through the femoral artery. Femoral artery passes through the fifth osteoaponeurotic opening to enter the popliteal fossa. Then it is called as popliteal artery. So it is from fifth osteoponeurotic opening to the lower border of popliteal muscle, that is in the floor of popliteal fossa. Termination divides into anterior and posterior tibial arteries. So these are the boundaries of popliteal fossa. So this is the popliteal artery, you can understand. It courses from medial to lateral, from the fifth osteoponeurotic opening to the lower part of the border of the popliteus. So in its course, it is coursing medial to lateral. And this is the popliteal vein crossing over the popliteal artery. And these are the two divisions of the sciatic nerve. So the middle one, or in the middle of the popliteal fossa, that nerve is the tibial nerve, and this nerve is the common peroneal nerve. Relations of popliteal artery. So this is the popliteal artery above and medially. What is the relation? Semimembranosus and semitendinosus. Below and medially, you can appreciate popliteal vein and the tibial nerve. Above and laterally, popliteal vein, tibial nerve. So that is the above and laterally. Below and laterally, so here is below and laterally, that will be the lateral head of gastrocnemius. So I have simplified the relations of popliteal artery for you to understand. I think you should have understood now. Branches of popliteal artery: cutaneous artery, sural artery, and also muscular branches. 5 genicular branches: superior medial and superior lateral genicular arteries, and middle genicular artery, inferior medial and inferior lateral genicular arteries. They form the genicular anastomoses. I think you should have known by this time what is genu. Genu means knee joint. So genicular branches. This genicular anastomoses may be asked as short notes or very brief answer. So these are the 5 branches of popliteal artery: superior medial, superior lateral, middle genicular, and this inferior medial and inferior lateral genicular arteries. So we will now continue with the applied anatomy of popliteal artery. Popliteal pulse. It is deep in the fossa, difficult to feel. Commonly, how can we then palpate the popliteal pulse? In this position, performed with the person in the prone position and with the knee flexed, so that to relax the popliteal fascia and the hamstrings. Then you have to feel the popliteal pulse deep in the fossa. Popliteal aneurysm may be causing edema and pain in the popliteal fossa. So we have completed the popliteal artery. The tibial nerve in popliteal fossa, common peroneal nerve in popliteal fossa may be asked separately, or if popliteal fossa is asked, you have to write about every content, every major content in detail. Tibial nerve in popliteal fossa. Origin: larger terminal branch of sciatic nerve. So sciatic nerve has two components, tibial component and common peroneal component. It divides now in the, or it terminates in the upper angle of the popliteal fossa. So it is formed by ventral branches of ventral rami of L4, L5, S1, S2, S3. So from the back of the thigh, the tibial nerve passes vertically in the middle of popliteal fossa. Exit from the fossa. Yes, this is the tibial nerve. Sciatic nerve, this is the sciatic nerve. So you can appreciate this is the sciatic nerve in the upper angle of popliteal fossa. So popliteal fossa has 4 angles: upper angle, lower angle, and 2 lateral angles. So this sciatic nerve divides at the upper angle of popliteal fossa into tibial nerve and common peroneal nerve. Tibial nerve will be running in the middle of the fossa, as if dividing the fossa into 2 halves. So this tibial nerve, how it leaves? It enters the back of the leg. that is the posterior crural region, that is the back of leg, accompanied by posterior tibial muscles under cover of the soleus muscle. So this is the tendinous origin of soleus muscle. You should learn this origins very correctly. Then you can appreciate how it takes origin from both bones of the leg. So it passes deep to this tendinous origin of soleus muscle. In the fossa lies lateral to the popliteal vessels in the upper part. So this is popliteal artery and this is the tibial nerve, lateral. Overlap the vessels in the middle, lies medial to the vessels in the lower part. This we have understood very clearly when we covered the popliteal artery already. Branches of tibial nerve in popliteal fossa, muscular branches. It is the tibial nerve. Now you should remember sciatic nerve has supplied the back of thigh. It has divided into tibial nerve and common peroneal nerve. So this tibial nerve will continue in the back of leg, then enters the sole of foot as terminal branches. So naturally the tibial nerve supplies the back of leg muscles, both heads of gastrocnemius, plantaris, soleus, popliteus, all these are the back of leg muscles. Articular branches to the knee joint, superior and inferior medial genicular nerves and middle genicular nerve. Cutaneous branch, sural nerve. This is again an important cutaneous branch from the tibial nerve. Applied anatomy of tibial nerve. So if the tibial nerve is cut in the popliteal fossa, so naturally the muscles of back of leg and sole of foot will be losing its nerve supply. Foot will be held in the dorsiflexion and eversion. Sensory loss on the sole of the foot. So you just imagine sensory loss on the sole of the foot. So we will not feel the sensation. So that may lead to the trophic ulcers on the sole of the foot. Sural nerve is used for nerve grafts. So this completes the tibial nerve. Now we will see the common peroneal nerve or common fibular nerve, otherwise called. Once it was asked as essay in the university exam, but it is a very short essay. Common fibular nerve, origin. It's the smaller terminal branch of sciatic nerve. So we have learnt sciatic nerve divides at the upper angle of popliteal fossa into tibial nerve and common peroneal nerve. It is formed by dorsal branches of ventral rami of L4, L5, S1, S2. Course. The nerve appears in the fossa beneath the long head of biceps. So this is the long head of biceps. So the nerve appears in the fossa beneath the long head of biceps. You can appreciate the common peroneal nerve is following the lateral border of popliteal fossa in the upper part and it leaves. So I used to think as if this common peroneal nerve is running in the fossa as if it is not concerned with the fossa. The tibial nerve is running very authoritatively in the popliteal fossa in the middle of the fossa, and common peroneal nerve is running as if it is not related to the fossa. That's how we have to remember. Slopes downward and laterally along the medial margin of the biceps tendon. So this is the biceps tendon. At the lateral angle of the fossa, it crosses superficial to the plantaris and lateral head of gastro. So you can appreciate here it crosses superficial to the plantaris and lateral head of gastrocnemius. Reach the back of the head of the fibula. So where the nerve rests on the thin fleshy seat of soleus, where it can be rolled against the bone. So over the neck of fibula, this common fibular nerve can be palpated. You should know what are the nerves that can be palpated, so that in the cases of nerve thickening in some diseases, you should know what are the nerves can be palpated. For example, you should have learnt ulnar nerve over the olecranon process. Now this common fibular nerve over the head of neck of fibula. Finally, the nerve curves are forward on the lateral side of the neck of fibula deep to the peroneus longus muscle. So peroneus longus is a muscle of lateral compartment of leg. So now you should understand this nerve has entered the lateral compartment of leg, where it divides into terminal branches, superficial and deep peroneal nerves. So now you should understand tibial nerve has entered the back of leg. This common peroneal nerve will divide into two terminal branches that will supply the other compartments of the leg. So now branches of common fibular nerve. They are the terminal branches we have learned, superficial and deep peroneal nerves. Cutaneous branches, sural communicating and also lateral cutaneous nerve of calf. Articular branches, superior and inferior lateral genicular and recurrent genicular nerves. You should remember popliteal artery gives rise to 5 genicular arteries. Tibial nerve gives rise to 3 genicular nerves and common fibular nerve gives rise to 3 genicular nerves. So now we have come to the applied anatomy of common fibular nerve. Injury to common fibular nerve is common because it is over the neck of fibula. So you just imagine fractures of the fibula, then that will injure this nerve. So if fracture neck of fibula or even after fracture, if we are applying plaster cast application, this common peroneal nerve may be compressed. So if it is compressed, what are the compartments of the leg that are going to be paralyzed? So the other two compartments of the leg, that is anterior and lateral compartments of the leg and the dorsum of the foot. So that will result in the foot drop. So foot drop and wrist drop are very important clinical findings you should understand. So how the leg will be held? Ankle will be held in the plantar flexion and foot in the inversion. So that is the position of the foot in the foot drop. So sensory loss will be over dorsum of foot and lower part of front of leg. So we have completed this popliteal fossa in very detail, which is an important theory question and also the practical question. I have covered in detail this popliteal fossa, popliteal artery, tibial nerve and common peroneal nerve in this video. So with the next topic in the lower limb, we will see in the next video. Those who have not subscribed to the channel, do subscribe now. Keep watching the video so that you will have the continuation of gross anatomy, histology, embryology and also neuroanatomy. So do subscribe now. Keep watching the videos. Thank you.